It's Nick Bento for my physical assessment video, and pan around. It's my patient. Nothing there, it's just a table. And that's just a blank piece of paper that's gonna be for my vital signs. All right. So, hi, my name's Nick. I'm gonna be your nurse. And can I confirm your name and date of birth?
Allison Bento, 1689.
All right, confirm on the ID band. So move the camera up a little bit. All right, better. All right, do you have any allergies to medication or food or the environment, like
No.
bees, dogs, anything like that?
No.
Pollen? No? Okay, great. So we're going to begin by taking vitals. All right, so with your blood pressure. All right, 118/76. Okay, now check your pulse. Now do this for a minute, counting pulse and respirations. Pulse is 80, respirations 12 per minute. Take a temperature, I would have a thermometer obviously. Take a temporal temperature, 98.6 degrees Fahrenheit. And I'll check the oxygen, SpO2, say 99%. Okay, so now for the Snellen eye exam, can I have you stand up? And have the patient stand 20 feet from the Snellen chart, and I'm going to ask you to read starting from the top line from left to right, and once she gets more than half the line wrong, then the line above that is going to be her vision. And normally I would do this with glasses on, then off, both eyes, and one at a time. For this, just one at a time. So can you cover your left eye, and start reading the chart with the top line from left to right?
A, B, C, D, E, F, G, H. That's all.
Okay, so she got one wrong on the third line, so right eye. Okay, can you do that with your other eye, with your right eye? Perfect. And same thing, top to bottom, from starting from the top line, left to right.
A, B, C, D, E, F, G, H, I, J.
Okay, perfect. Now you can sit back down. Okay, so it's the vitals. So oxygen, SpO2, 99%. Oops. Forgot to write down temperature. Okay, so oxygen is 99%, blood pressure 118/76, millimeters of mercury, right arm, sitting, 16 breaths per minute, 80 beats per minute, radial, 98.6 degrees Fahrenheit, temporal, right eye 20/40, left eye 20/30. Okay, so I'm going to begin the assessment now. It's already got your name and date of birth. Can you tell me where you are?
I'm at my doctor's office,
Okay, tell me why you're here.
just to check out.
Okay, can you tell me what day of the week it is?
Tuesday,
All right, so alert and oriented times 4. How would you describe your mood today?
good,
How was your mood from day to day?
generally good.
Generally good? What do you mean by good? Like happy?
Mm-hmm.
Okay, perfect. Are you in any pain today?
No.
No? Okay. So I'm going to begin the assessment with your eyes. I'm going to ask you to take off your glasses. Are those prescription glasses?
Yes.
How long have you been wearing prescription glasses for?
3 years.
3 years? Okay. Just going to shine my light in your eyes. I'm going to do it in each eye twice. Okay, and look at the other pupil. Okay, so direct constriction, brisk, consensual constriction, the other eye's a bit sluggish. Alright. Okay, so both eyes, direct constriction is brisk, the consensual is a little bit slower, sluggish. So I'm going to hold my pen light and ask you to follow with your eyes only. Okay, and keep your eyes on it as it comes closer. All right, so no nystagmus and convergence is there. Okay. Do you wear any hearing devices, hearing aids?
No.
No? Okay. Tell me if you feel any pain while I palpate.
No.
And on this side?
No.
All right, so mastoid process, no pain. I'm gonna take a look inside your ears. All right, minimal cerumen, no drainage, no redness, no skin breakdown. This here. Same thing, minimal cerumen, no drainage, no redness, no skin breakdown in the back. Okay. I'm going to ask you to plug your left nostril, your left nair, and close your eyes, and tell me what you smell.
Mint.
Mint, okay. And grab another cup, and can you plug your other nostril, keep your eyes closed, and tell me what you smell.
Coffee.
All right, perfect. I'm gonna flash my light up your nose, take a look. All right, so mucosa is moist, no drainage, no redness, no bleeding, no polyps. Okay? And do you wear any dentures?
No.
No? Okay. Can you open your mouth for me? Oh, mucosa pink and moist. Tongue pink and moist. Can you lift up your tongue? Frenulum is midline. Can you stick out your tongue for me? Can you move it to your left and to your right? All right, perfect. And we're gonna grab a tongue depressor. Can you open your mouth again? And say ah. All right, tonsils grade 2. And one more time, ah. All right, uvula is midline. Uvula and soft palate move up. When she says ah. Can you puff out your cheeks? Can you smile? Can you frown? Can you raise your eyebrows? Can you close your eyes? All right, perfect. And I've got a cotton ball here. And can you feel this on your arm?
Yes.
All right, so I'm going to ask you to close your eyes and just say now when you feel this on your face.
No.
Okay?
No. No.
All right, perfect. Thanks. All right. I have a glass of water here for you. I'm going to ask you to swallow. Just take a little sip and swallow. All right, gag reflex good. And I'm going to feel your throat while you swallow again, please. All right, thyroid is non-palpable. Okay. All right. Trachea is midline. And can I have you lean back? Patient would be at a 45-degree angle. Can you turn your head to your right? Okay, can you turn it the other way? All right, no jugular vein distension. And hygiene. I'm going to feel your pulse. Okay. All right, carotid artery is +2 bilateral. Can you hold your breath for a second while I listen? Okay. And same thing. All right. No Brewitt, listen with the bell. All right, can you turn your head completely to your left and to your right? All right, can you put your left ear to your left shoulder like this? And the other way to your right shoulder? All right, good. And I'm going to sanitize my reflex hammer. Move on to your arms. So, actually first, can you lift up your shoulders while I push down? All right, perfect. So, let me see. Okay. Tricep. Okay. And your bicep. Brachioradialis. All right. Other arm. Tricep reflex. Just relax. Good. Brachioradialis. Okay. And I'm just going to check your patellar reflex as well while I'm doing reflexes. And you can just kind of relax your leg. Perfect, let it swing freely. Okay. And we do the same thing over here. Yeah, just lift it up and relax. All right, good. All right. Okay, so I'm going to just feel for any difference in size or anything like that. No lesions, no cuts. Feel for temperature, even throughout. Skin is dry. I'm going to check capillary refill. All right, capillary refill is brisk, under 2 seconds. And I'm going to ask you to put your arms straight out to the side. And can you rotate them? Can you put them back down? All right, good. I'm going to do a couple of coordination tests. Can you do that again with your arms straight out to the sides? Can you put your right index finger to your nose? And with your left finger? Can you do it with your eyes closed? Okay, good. Can you push up on my hands? You push down on my hands. You squeeze. Okay. And with your hands flat on your lap, can you rotate your hands quickly like this? All right, good. And can I have you stand up? All right. So I'm 2 feet behind the client for the whisper test. Can I have you plug your left ear? You know, what's your phrase? Just repeat it to me.
ABC.
Okay. Can you switch and plug your right ear?
1, 2, 3.
All right, great. And I'm going to ask you to put your feet straight together with your arms at your side and just look straight forward. Perfect. Romberg test, we'll do this for 20 seconds. Can I ask you to close your eyes now? And same thing, I'll do that for 20 seconds. Minimal swaying, balance is good. You can open your eyes now. Can you walk with your, just stare straight ahead and walk across the room? All right, and can you walk back heel to toe? All right, good. And you can sit back down. And I would have the patient lying down when doing this, but can you, with your heel, put it up to your shin and put it straight down? And slide it down your leg. Okay, and then with your other leg. All right, good. All right, so now I'm going to check your lymph nodes. Okay. All right, all lymph nodes non-palpable. Check skin turgor under the clavicle. Skin turgor is good. Okay. So, do you smoke at all?
No.
Do you have any breathing problems like asthma or COPD or anything like that?
No.
Do you have any heart issues?
No.
No? Okay. So I'm going to, can you stand up and turn around for the camera? And check respiratory expansion. And take a deep breath. Take a deep breath. Okay. So my hands went out evenly. Respiratory expansion is good. And I'm going to listen to your lungs. Every time my stethoscope touches you, can you take a deep breath? Okay. Okay. And listen on your, can you lift up your right arm? I'll listen 4th to 6th intercostal space at the mid-axillary line. Deep breath. Okay, you can sit back down. And same thing, deep breath every time I touch your stethoscope. All breath sounds clear, all locations, no diminished breath sounds. Unlabored respiratory pattern. I'm going to listen to your heart. All right. Aortic, S2 louder than S1. Pulmonic, S2 louder than S1. Herbs, S2 equal to S1, and listen with both the bell and the diaphragm. Tricuspid, S1 louder than S2. Mitral, S1 louder than S2. Can I have you lean forward? Apical pulse, so listen for 1 full minute. Rate is 80 beats per minute. Okay. And check the skin throughout the back. Skin is equal temperature bilateral, no lesions. Same thing on the front. And can I ask you, when was your last bowel movement?
This morning.
This morning? About how often do you have a bowel movement?
Once a day.
Once a day? Is it like watery or is it formed?
Formed.
Okay. Is there ever any blood in your stool?
No.
No? And what color would you describe it as?
Brown.
All right. Do you ever have pain with urination?
No.
Do you have any problems with urgency, like all of a sudden the urge comes on to urinate?
No.
No? Any blood in your urine?
No.
When was your last menstrual cycle?
May 5th.
All right, perfect. So can you lift up your shirt so I can look at your abdomen? All right, so it's symmetrical, no skin breakdown, and I'm going to listen. would listen 1 full minute in each quadrant. Bowel sounds are normal, active, about between 5 and 30 gurgles and sounds per minute. And we'll listen to your arteries in the abdomen with the bell. Alright, so aortic, renal, and femoral arteries, no bruits. Okay, I'm going to percuss and palpate. So percussing. Alright, tympany throughout. And I'm going to palpate lightly. Let me know if there's any pain or tenderness. Okay. Any pain?
No.
I'm just going to go a little bit deeper. Any pain?
No.
All right, so no mass is felt. Okay, you can lower your shirt now. Do you have any difficulties with walking, or do you use like a cane or a walker or anything like that? Any assistive devices?
No.
No? Okay. So I'm going to check your pulses first. All the way down, it's going to start with your brachial, plus 2 bilateral, radial, plus 2 bilateral, popliteal, 2 plus bilateral, posterior tibialis. Can they see? I'm just going to adjust the camera. Shoot. All right, can you lift up your leg just for the camera so you can see where I'm assessing behind the ankle, posterior tibialis. Bilateral is 2 plus, and the dorsalis pedis. And I'm going to do that at the same time. Bilateral is 2 plus. Check capillary refill. Brisk under 2 seconds. Same with this leg. All right, thanks. All right, brisk plus 2 bilateral. Okay. And can I have you extend your knee out, your right, and then back in? All right, and then with your other leg. Okay. And can you, I'm just gonna pick up the camera so they can see my assessment, what I'm asking you to do. Can you lift your foot up, like with your, at your ankle, correct? And then down, all right, with your other one. All right, perfect. Can you, oh, now we can see. All right, can you rotate your ankles in and then out? Okay, good. Can you stand up? Can you move your leg to the side and then back in? And with your other leg? Okay. Perfect, and that's it for my assessment. Do you have any questions for me right now?
No.
All right, thank you.